In the cardiovascular system, we have two lab standards, and so I'm going to cover both of them in this same video. We're going to be talking about how blood pressure is measured and reported, as well as what are the different anatomical highlights of a mammalian heart that you will have to identify. Your standard HEART.3 asks you to report blood pressure and explain how it is produced and controlled. HEART.4 asks you to identify the major structures of the heart on a model organism, again being a sheep, and describe the function of each part. So, in the first video for the first two heart standards, we talked about the purpose of the cardiovascular system as a circulatory set of organs. We also mentioned that there were two primary circuits that blood follows. The pulmonary circuit, where we're heading to the lungs to pick up oxygen and drop off carbon dioxide, and the systemic circuit, where we are doing the opposite in body tissues. The first new heading for today, HEART.3, covers blood pressure. You might have seen this device in the picture. I'm sure you've had your blood pressure read like this at the doctor, though probably with a machine and maybe not with the doctor unless they're trying to confirm that you have high or low blood pressure. So when we say blood pressure, what we're measuring is how much force is being exerted on the inner walls of your arteries. So we're not looking at capillaries or veins or venules, we're looking at arteries. And the units that we use are a unit of pressure called millimeters of mercury. From chemistry, you might remember units like torrs and atmospheres, but blood pressure utilizes mmHg. The tool that you're seeing there with the blood pressure cuff and the stethoscope and the bulb and the valve, all of that together is referred to as a sphygmomanometer, and that's the tool you're going to utilize in lab to read your partner's blood pressure. There are several different readings because when a heart pumps, there is that initial force of the blood as it's being rushed through the artery, and then there's the more relaxed in-between heartbeat pressures. So if you've ever heard someone report blood pressure, they'll usually say two numbers, like 120/80, for example. The 120 is called the systolic pressure, and that is your max pressure on your arteries when the ventricles, when your heart is contracting. The bottom number is the diastolic pressure. So that is your minimum pressure placed on the walls of your arteries when you're in between heart contractions. We can take those two numbers and find the difference between them, and that is then referred to as the pulse pressure. And we can also find an average overall pressure. If we have this high number and this low number, the mean arterial pressure is determined by adding the diastolic to 1/3 of the pulse. So that little formula you see right there, and that will give us an average over the entire cardiac cycle. There are different stages of blood pressure, so you don't have high blood pressure, at least formally, until you're around 140 millimeters of mercury over 90. Anything that or above is considered having high blood pressure. There's a warning zone here in yellow, and then normal is 120/80, though a lot of people who are fit or young could have lower blood pressure than that. When you get up into the 160s or 180s, that's when you have severe damage that can be done to your arteries if that's what your pressure is all day, every day. You are going to be measuring, going back to blood pressure, you are going to be measuring your partner's blood pressure, and you're going to use specific sounds called Korotkoff sounds to analyze when to write down either the systolic pressure or the diastolic pressure, but we're going to cover the mechanism of how to use a sphygmomanometer more during lab. Okay, your other lab standard asks you to identify specific structures on the human heart, or the sheep heart. So first, the heart is made of cardiac muscle, so it's going to look stringy, it's going to have that striated muscular appearance, but it also has several walls and coverings. It sits a little bit in the left of your thoracic cavity, and it varies with your body size. A good estimate is roughly the size of one fist. Okay, coverings first. So on the outside, the most superficial covering, there's this really tough white substance called the fibrous pericardium. You may have this on your heart, but a lot of times it's already taken off when the company sends the hearts to us because it is tough to get through and you can't really see anything. Inside that, you have another layer called the parietal pericardium, which is sitting just inside of it. And then the deepest one is the visceral pericardium. So there are 3 layers on the outside of the heart before you even get to any of that cardiac muscular tissue. When you do, there are 3 wall layers as well. The outer wall is the epicardium, meaning around or above or outside of. Most of the heart is myocardium. So myo refers to muscle. We've seen that when we talked about myosin. So the thick muscular active layer is known as myosin or myocardium. And then the innermost layer is the endocardium, sort of lining and protecting that myocardium. And this is the layer that will be up against the blood that's in the heart. Here is a list of most, if not all, of the structures you'll have to identify on the heart. And I am going to highlight which ones are chambers, valves, septa, which means like dividers, and vessels. And I've color coded them so that if you're drawing this in your notes, you can color code the picture that you draw. So chambers first. We are mammalian and we have 4 chambered hearts. So there are 2 chambers on the right side and 2 chambers on the left side. The upper chambers, you'll notice, are thinner, much less muscular. They're smoother, and they're called atria. One is called an atrium. The lower chambers are much thicker, and those are called ventricles, and that is where the muscle power for heartbeats come from. So the atria is more of just a receiving chamber. It passively accepts the flow of blood, and then after it passes through a valve, we have most of the muscle power coming from the ventricle. So right atrium, right ventricle, left atrium, left ventricle, with the left ventricle being the most muscular and strongest of the 4 chambers because it's responsible for pumping blood out the aorta to the rest of your body. There are 2 really important valves I want to highlight, and they separate the right side and left side. So on the right side, it's a 3-flapped valve, and that's why it's called the tricuspid valve. I remember that because there's an R in this word, and so it's on the right side, whereas the bicuspid valve, which is sometimes called the mitral valve, but I usually use bicuspid, is on the left side. These valves are one-way that only allow blood to flow forward and prevent blood from going backwards, as that would be really inefficient and would lead to a lower blood oxygen level. Septa are dividers, so we have a big, thick muscular divide in between the left and right sides of the heart, down here in the ventricles, and that's called the interventricular septum. You also have one in between the atria called the interatrial septum, but it is covered up here by this artery. And then lastly, vessels. So you have some major vessels going in and out of the heart. The superior vena cava collected all the blood from your upper body, so it went like capillaries, venules, veins, and all those veins spill into that superior vena cava before it dumps the blood back into the right atrium. You also have one on the inferior side, which collects all the blood from your lower body. You have then from that right ventricle, you have blood leaving to go get oxygenated in the lungs. So we have a left pulmonary artery and a right pulmonary artery where blood is able to go either way to collect its oxygen. It's then going to come back from the lungs either through the left or right pulmonary vein and head back into the left atrium, pass by that mitral bicuspid valve into the left ventricle, and then it has to head out to the body. So we said the aorta was your biggest artery, which will eventually branch into major arteries of the head and neck, or it will go downwards behind the heart and deliver blood to the rest of the body. The human heart is going to look only a little bit different from your sheep. It's not going to be as clear as obviously cartoon pictures show. But it'll be your job. The most important piece you'll have to do is to make a good coronal cut, to cut the heart in a way that you can open it like a book and see those four chambers that we showed on the previous slide.